Senator Bennet.
Thank you, Madam Chair, and thank you. I've got relatives in Lee County, Arkansas, so I always have to say that to Senator Bozeman, and I completely agree on the broadband point. I think that
I'm extra special and nice to you because you have constituents.
I know that's right, and I think they probably vote for you too. So, but much more important than that, I think this infrastructure, the broadband package and the infrastructure bill finally. This town is going to stop subsidizing the largest telecom companies in America and instead build broadband in rural parts of this country because of what we've done with Senator Portman and Senator King from Maine. It was a tripartisan bill, and I'm very pleased. And I hope it comes to everywhere in Arkansas that needs it because a lot of people need it. And Michigan. Kids don't need to be doing their homework in grocery store parking lots. I want to thank you for holding this hearing. It's really, really important to my state, and I want to start by thanking the extraordinary people in rural Colorado, the healthcare providers that have fought through and sustained our communities during this COVID challenge. Even before COVID, they didn't have everybody here knows they didn't have the resources they needed to do what we needed them to do. And in the first year of COVID, from February to February, I actually traveled to all of Colorado's 64 counties, 47 of which are rural and frontier. And just last week, I had a conversation again with some rural providers, and they shared with me the challenges that they are facing to keep their doors open. And I've heard a similar lament all over the state, which is we need to update health infrastructure, and we have to address the mental and behavioral health crisis, especially facing our young people. The suicide rate in rural Colorado for young people is twice as high as it is in urban parts of my state. So Secretary Torres Small, you mentioned in your testimony that hospitals are closing across rural America. Indeed, that is true. With other challenges, these closures contributed to COVID-19. Listen to this. Being twice as fatal for rural Americans than other Americans. And that's one of the reasons why I wrote the Hospital Revitalization Act, which would invest $17 billion in our rural hospitals and clinics that are physically deteriorating, all at the same time, all across our country. Secretary Torres Small, could you tell us about the economic costs and other consequences of hospital and clinic closures in rural communities and why we should invest in our rural health infrastructure? And I have one other additional quick question, so thank you.
The economic costs are crucial when it comes to the impact in rural health care, whether it is the closure of a elder care facility, which I know in La Junta recently there was a closure, and rural development helped build a new senior living facility to replace that. And that's crucial. My grandparents ended up retiring in Colorado, and they chose the place specifically because there was a good living facility in a rural area where they could retire. So that's the direct impact that it can have. And when it comes to having those mental health care services that are crucial, farmer stress is an incredibly challenging issue. And the American Farm Bureau, along with the National Farmers Union, recently did a survey that showed that 74% of farmers have been directly impacted by the opioid crisis. So being able to provide that mental health support is crucial for rural America.
Thank you. And your parents, I'm sure, came over Raton Pass to make it to La Junta, so we're very happy to have them there. Madam Secretary, the COVID-19 pandemic has shed light on the mental and behavioral health crisis. It's been under the surface for years and years. According to Mental Health America, Colorado ranks 47th in prevalence of mental health versus access to care. Screenings for depression in Colorado increased 600% over the past year. And this is, again, everybody is being affected by this, but it is particularly our young people. As a former school superintendent, where I see the challenges of COVID. This is something I hear about from everyone in Colorado, but in rural Colorado, barriers like workforce shortage, low reimbursement, and stigma are only intensifying the problem. I've been working with a number of colleagues on proposals to address the crisis in the short term and the long term. For example, as the 988 Suicide Prevention Lifeline is fully implemented this summer, we're able to secure another $100 million to help with implementation. in the latest appropriations bill. I know that you're largely focused on closing the digital divide to help improve and sustain telehealth and other remote services, which I am grateful for. But Secretary Torres-Small, would you be able to identify any other USDA initiatives that would need more support from Congress to help address the mental and behavioral health crisis that we face?
So this is related to closing the digital divide, but it's not just about getting the fiber to the places that need it. It's about having the technology on the receiving end. So the distance learning and telemedicine grants are crucial. I've seen across the country places where they've been used to provide mental health services in rural schools, which limits the stigma because they can access it right in their school. So that's, I think, a great opportunity to get that mental health service across the country in a way that makes it more accessible for rural communities.
Thank you, Madam Chair. Thank you.
Thank you very much. Important questions. Senator Ernst, and then I believe we have Senator Gillibrand.